Imagine you are making coherent sentences in your mind when you speak, but the words coming out of your mouth do not make sense to others. This is the sad reality of many stroke and head injury patients. They suffer from a language disorder called aphasia. According to the National Aphasic Association, there are at least 2 million people in the United States that have this condition. I picked the topic of aphasia because I thought it was very interesting and I had some experience working with these patients. During my career as a paramedic, I worked with many aphasic patients, mostly stroke patients, but also head injury patients and dementia patients. Though I had some knowledge of this disorder, I wanted to get a more thorough understanding of the disorder. So today you will learn about the causes, 3 types, and treatments of aphasia. Okay. So what exactly is aphasia? The National Institute of Deafness and Other Communication Disorders defines aphasia as a disorder that results from damage to portions of the brain that are responsible for language. It can affect the ability to speak, write, understand both verbal and written language. Aphasia is caused by damage to one or more language areas of the brain. The most common cause is a stroke, which occurs when blood flow is cut off to parts of the brain due to either a clot or a ruptured vessel. When this happens, brain cells die. Other causes include severe blows to the head, gunshot wounds, brain infection, brain tumors, and also progressive neurological disorders such as dementia. There are 3 types of aphasia. The first type is non-fluent aphasia, also called Broca's aphasia. This type is caused by injury to the frontal lobe of the brain. These people understand speech but have difficulty getting words out. For example, they will say want food or walk dog, similar to a toddler that's just learning how to speak. They also have good understanding of their condition and can sometimes get frustrated for themselves. The second type of aphasia is fluent aphasia, also called Wernicke's aphasia. These people speak in extended, meaningless phrases and they use unneeded words and also can make up some words. So an example would be, you know that Snicker pickle need what take you, when they might be wanting to say, I want to take the dog for a walk. These people have difficulty understanding speech and are unaware of their mistakes. The third type is global aphasia. This is a combination of both fluent and non-fluent aphasia. It results from extensive brain damage to both the frontal and temporal lobes. These people have difficulty with both speaking and understanding language. So there's no medical cure for aphasia, but most people improve over time, especially in the first couple months. When aphasia remains after this initial period, then speech-language therapy is needed. The therapist will help the person build on remaining language with restorative therapy. They're helping the person learn how to speak, learn how to form words, and also compensatory therapy where they're using gestures, pictures, and electronic devices to help the people communicate. Another treatment being studied for the Mayo Clinic website is brain stimulation therapy, which is non-invasive therapy that helps stimulate damaged brain cells. They use magnetic fields and low currents with electrodes that they place on the head. As of now, there's more research that needs to be done before it can be recommended. In conclusion, today I spoke about aphasia, its causes, the 3 common types, and the treatment. I hope this speech has given you a better understanding of the condition called aphasia. And if you come in contact with one of the 2 million people in the United States that has aphasia, hopefully you better understand their needs and maybe can communicate a little bit better with them. That's it.
Thank you.
How much time?